Welcome back. We're doing a Friday edition today. I've gotten a lot of flack about not wearing red on Friday like everybody else does in Omaha and Lincoln. And we're 3-0, and I have not wore red on Friday. So for all of you crazy Husker fanatics, I think it's probably working, so I will not wear red. Plus I went to Shattered State. So we're going to talk today about classifications and what low back pain is or isn't, and some of the common causes of low back pain, because low back pain isn't just this one thing that we can put our finger on every time. That's why there's no magic bullets for treatment, and that's why it's so important that when we do have somebody come in with low back or neck pain, that we classify what it is that we're dealing with, not only from like the structural standpoint, but also from a functional standpoint. So Dr. Peter's going to speak a little bit about how we do this, the classifications.
So most of low back pain kind of falls into this blanket diagnosis of non-specific low back pain. Hold on.
Oh, about lost the camera. It's the fun about being live. All right. Whew. That was a near disaster.
We really are live, folks. So it kind of falls into this blanket diagnosis of non-specific low back pain, and what that is basically it refers to any type of back pain that cannot be attributed to spinal pathology, serious pathology. That's kind of like your cancer, infections, fractures, where people's minds typically go when they have some back pain, like, oh, worst case scenario. So it's not attributed to that or any specific cause. So it doesn't mean like we can't take an MRI and say, oh, this is the cause of your back pain. So it's kind of this blanket diagnosis, like, hey, we know you have back pain, but we don't really know why for a specific cause. So that's kind of where we come in, and the importance of being able to classify and understanding that we have all these different tools in the office. Well, what tool is going to fit what condition, what patient the best, and being able to individualize what we're doing in the office to each patient is of the utmost importance.
Yeah, and like Jace says, like, it's important because people get these diagnoses, and part of the diagnosis problem just inherently is that it creates almost like a fear or some sort of preconceived idea of like what you have. And a lot of times with back pain, it's nothing that there's nothing that fits a specific diagnosis. Yes, of course you're going to have diagnosis when you come here, but really, like, back pain in general and a lot of these musculoskeletal conditions don't fit into these nice, neat little diagnoses that we have. So what we pride ourselves on here is we do what we call functional triage. Like, we literally work you up in a number of different ways. Orthopedically, we take a history, we do neurological testing, and then we do functional screening, and we use our hands to kind of feel around in there, because there's many different reasons why you can have back pain. There's a lot of sources of back pain. You can get it from a joint, you can get it from a muscle, you can get it from a combination of those two, you can get it from a ligament, you can get it from a disc, you can get it from the bone. And so we have to kind of sort through all of these different symptom generators and find out, one, what is it that's driving your symptoms, and two, why is that there, and what caused this structure to become irritated.
Yeah, I think and then I think to add to that is with the fear and the panic, like, you don't need to panic. Back pain is very, very common. That's why there's a lot of chiropractors, PTs. I mean, everybody's trying to figure it out. The percentages are like 60 to 80% of people will have back pain at any one time throughout their life. And a lot of times that subsides very, very quickly. Like, it doesn't hang around a lot. You probably had an episode and then you feel better and you don't really know why it went away or what you did. But the problem is that reoccurrence is a really big deal. Like, 60% of people get reoccurrences. So our job is to try to limit those episodes, so like get your symptoms gone so you can keep doing what you want to do, and then address some of the dysfunctions, the functional stuff that we find, to hopefully prevent reoccurrences. Because if you've ever had an episode of back pain, whether it's been for 2 days or 2 months, like, it can be pretty debilitating, and it prevents you from doing what you want to do.
Yeah, there's a recent study, the most recent study I can remember as far as reasons for people to go see doctors. Back pain was actually number 2 on the list, and this was a study that was probably done 10 years ago, so it's hard to say what it is now, but it's one of the leading reasons for you to go to a doctor is actually back pain. The others were common colds and things like that, so it's as common as your colds and flu viruses. The problem with back pain and typical medical treatment, and this is not anything against the medical doctors, is that a lot of times there's a mechanical reason behind why you have back pain, and they're not really armed to treat mechanical pain because they really have more chemical solutions, even though there is a chemical preponderance to back pain to some extent. So it's hard to treat something that's mechanical with a chemical solution, and so that's why we work closely with our medical professionals here in Omaha, because that does help. It helps the chemical part of it, the inflammatory part of it, but there's always that underlying mechanical reason that we really have to kind of sort through, because we have to figure out what it is that's driving your symptoms, what's creating the main issue. Is it the joint? Is it the muscle? Is it the combination of those two? And then why is that there? Like, why are those joints and those ligaments and those muscles being so overloaded? Is it a muscle patterning problem? Is it a repetitive use problem? Is it a postural reason? Like, we have to really kind of sort through those things. And then along with that, we have to reassure you that you're going to be okay, because the biggest problem with back pain and these other kind of conditions is once you get that preconceived idea of this diagnosis that you're given, then you start to move less, and we get what we call fear avoidance or deconditioning, and then you go down this downward spiral that's very difficult to kind of stop that cycle and reboot that system and get you going the other direction. Because once you start to decondition and you start to move less, then you lose muscle tone, you become very unstable in your joints, and then we're dealing with an issue where we actually have to kind of start all over again. Not only do you have this wound up pain mechanism going on all the time, and now normal movement hurts, but now you also start to lose the muscle that's basically where we need muscle to be to help stabilize those joints, and now you've got an unstable system and you don't like to move and everything hurts when you move, and then that's a very difficult thing for us to kind of stop and then reverse. So if you do have some of those issues, the earlier the better. Like, and to not stop moving, like move in smaller planes or smaller distances, but keep things moving. Like, one of the worst things you can do is to just lay down and do bed rest. That used to be like the recommendation for back pain was a week's worth of woo-hoo-hoo. Good save, Corey.
We about lost it again. I have to put some Velcro.
Yeah, so like we were saying, so some of the best tips. We're a little crooked here. So some of the best tips, we want to stay active. So movement is medicine. Like the back pain, bed rest for back pain is probably some of the worst advice that we can give anybody. So we want to stay active, try to continue to be in your normal routine, maybe back it down a little bit, but you still want to keep moving. The medication, if you're going to your primary care, like the chemical solution, that can help you calm the symptoms down, so then you can stay active. Like, that's the goal, is to continue to move. Another one is don't panic. Low back pain is very, very common. Like we said, a lot chiropractors, everybody that treats back pain is in business because it's very, very common. And then lastly, I think we want to always start conservative. We want to start, we don't want to get the horse before, or the cart before the horse. Like, you got to understand, we want to start conservative, whether that's chiropractic, physical therapy, just staying active on your own, and then if necessary we can progress it to imaging, to to any medication, to injections. And we kind of understand, we like to be the portal of entry for patients, so we can quarterback that, because we are a conservative solution. So we like to see those patients first, rather than sometimes I think we kind of see them on the back end after everything else hasn't worked, and it's just way out of order, and we kind of get frustrated. Patients get frustrated.
Right. Yeah, and that's a good point. Is like I said, the earlier you can get to somebody, the better off you'll be. And I would, like Dr. Peters just said, like, I would recommend you go someplace conservative, someplace that's going to be able to treat you with manual therapies, exercise, some of these other things that are less invasive. Because once you go down the invasive route, it's hard to kind of go back and do the conservative stuff, which we do see. We see a lot of that, and it's just harder for you and for us to kind of get you back to where you want to be. So the earlier you can get to somebody that's conservatively minded, the better off you're going to be. Anything else you want to add there?
I don't have a lot to add. I think we kind of covered it today.
Yeah. So as far as just realize the back pain isn't this all-encompassing thing, and there's a lot of different reasons you can have back pain. There's a lot of different symptom generators, and you need to find somebody that can kind of sort through all of that and determine kind of the best route to treat that, and also to kind of prevent you from getting those reoccurrences that Dr. Peters talked about, and that's what we're here for. So because we are a sport spine and sport institution here, I thought maybe we'd do something fun. And Dr. Peters played Creighton soccer at Creighton. I played football for Chadron State. So we're going to do our weekend predictions for 3 of the games. Creighton plays DePaul, right?
Yeah.
And any prediction?
I think coming off a tough game, Wednesday night they played Denver, who was ranked 8th. It was a 0-0 tie. I think Creighton comes out. It's going to be a tough game to get up for, but I think they will win 2-1 is my prediction for that.
Great. Chadron State plays Adams State. Chadron State's got the injury bug going on right now. Coach Long, Coach Steiner are fighting through some injuries to some key players, and they've had 2 really tough games. But I think they get back on the winning side, and I think they win 35-20 this weekend up in Alamosa, Colorado, one of my favorite places to play. And then lastly, we got the Husker game. Huskers 3-0 going into Northwestern, who's always given us a hard time. This game makes me nervous. I think we squeak out a win 23-20.
I think we come out in a couple touchdowns. I think the hype is building. Hopefully we don't come out flat against Oregon after the Oregon game. We always play them tough, but I'll be in Chicago, so hopefully 2 touchdown win.
There we go. And I think Hemingford and Granite just keep winning. So we'll see you guys next week.